Welcome to Beyond the Article, Health and Communication Distilled, a podcast of the Journal of Communication in Healthcare, Strategies, Media, and Engagement in Global Health. Each 10-minute episode features conversations with our authors on translating their research findings into practical and policy recommendations that will ultimately improve patient, community, and population health outcomes.
Welcome to another episode of Beyond the Article, Health and Communication Distilled, a podcast series from the Journal of Communication in Healthcare, Strategies, Media, and Engagement in Global Health. My name is Radhika Ramesh, and I'm the Senior Editorial Assistant, as well as Special Section Co-Editor Interviews at the Journal. I'm here with Dr. Amy Henderson Riley, who is an Assistant Professor at the Jefferson College of Population Health, Thomas Jefferson University. And also with me is Elizabeth Critchlow, who is a dual degree MD MPH student, also at Thomas Jefferson University, currently in her final year of medical school. Amy and Lizzie are two of the co-authors of the article Vignettes as Research Tools in Global Health Communication, a systematic review of the literature from 2000 to 2020. This was published online earlier this year, and today we'll be talking about the implications of the research presented in this article. Amy and Lizzie, thank you so much for taking the time to be with us on this podcast today.
Thank you so much for having us.
Great. To get started, Amy, could you please tell us what vignettes are and what advantages they offer over direct questioning in research settings?
Sure. So let's start with the definition. So what is a vignette? Well, a vignette is a short story or a little narrative about a hypothetical person, so not a real person. So vignettes are used both in quantitative and qualitative research. They're used to gather information on indicators kind of across the social ecological model. So you can use vignettes to measure knowledge or attitudes, behaviors, social norms. Vignettes can be read to participants, or participants can read a vignette themselves. They can be watched on a video or via a graphic or a series of photographs. Vignettes have become really popular in recent years in health communication, particularly in global health. But back to your question, as opposed to direct questioning, vignettes allow the participant to answer from their own perspective, or rather the perspective of the imaginary person instead of themselves. Let me give you an example. So say you want to conduct formative research to understand knowledge and attitudes about teen pregnancy, so you can then develop a health communication program. So a vignette on this topic could tell a fictional story about a teenager who's actually from the research participants' community who gets pregnant, and then ask specific questions about pregnancy knowledge and local attitudes. So there's a couple of advantages to this technique. So first is that vignettes allow the researcher to get specific answers to a very concrete and specific scenario. So as opposed to, say, broad questions that might appear in a survey or an in-depth interview. Lizzie, do you want to jump in here?
Sure. We've also seen how vignettes are useful in talking about sensitive or taboo topics like health-related sexual behaviors or mental health. So when asking someone directly about their opinion about a taboo topic, participants might be initially hesitant to share their true feelings, and as a result, responses are subject to social desirability bias. By using vignettes to shift the focus of the question to an imaginary third party, researchers can desensitize the scenarios, which decreases the likelihood of social desirability and response bias. In communities where certain beliefs or behaviors are socially sanctioned or regulated, using vignettes can also minimize potential harm to participants directly by kind of removing the target of the questioning onto the third party rather than the participant themselves.
Fantastic. So now that we have an understanding of what vignettes are, can you walk us through your research itself and its findings?
So our research was a systematic review, and our goal was to summarize and also validate the use of vignette methodology in published global health communication research. To evaluate the validity of vignettes in this setting, we applied a 14-item checklist that was derived from evidence-based recommendations for developing vignettes from a paper by Evans et al. So items in that checklist included deriving information from the literature or clinical experience and creating content that is relatable and relevant to participants. So for a systematic review, we searched 3 databases, CINAHL, PubMed, and Scopus, as well as Google Scholar. And we used a software called Ryane to facilitate the screening process. We screened articles for eligibility based on whether they reported primary research and whether they utilized vignettes as tools specifically to evaluate health communication programs. So we found 65 articles total that met eligibility requirements. And of those 65 articles, we found that most took place in North America and Europe, and most were quantitative outcome evaluations of health communication programs. In looking at our validity measurement, it revealed that few studies actually explicitly derived their vignettes from literature or clinical experience, and none of them actually met all vignette validity checklist criteria. This research overall was a really wonderful collaboration of our 7-person team, which included 6 students under the leadership of Dr. Riley. And we're really grateful also for the help from our university librarians who kind of walked us through conducting a methodologically sound systematic review.
Thank you. Can you give us a few examples of how others utilize vignettes in health communication interventions or advocacy efforts? I know you mentioned a few scenarios in one of your earlier answers. So Amy, would you like to start?
So vignettes have been used in several different studies about female genital mutilation, or FGM. So as Lizzie was saying earlier, the vignette technique works really well for sensitive health topics like FGM. Participants in previous studies on FGM have answered questions about fictional people, so fictional parents who in the vignette are deciding whether or not to have their daughter undergo FGM. So participants in the past have answered questions about how the parents might feel and what would happen, if they decided to get their daughter cut or didn't decide to. So this is done on purpose, of course, so participants don't have to talk about their own experiences or their own opinions. And specifically, this technique can help unwrap social norms, which are not easily measured in traditional research approaches. For example, participants have been asked, what if the parents in the story go against the norm and they don't have their daughter cut? What would happen? What would other people in the community do? Would other parents shun them? Would the daughter still be accepted? Would she be able to get married in the future? So these are the kinds of questions that are then asked. The key here is that the vignettes have to be in a language that's understood by the participants, easily understood, and these really need to be pre-tested ahead of time to make sure that they're culturally appropriate. Lizzie, you want to give another example?
Yeah, definitely. Another example is how vignettes are used in practice is to explore participants' beliefs about social norms around child marriage. So this is kind of similar to Amy's example about FGM, but child marriage, similarly to FGM, is a behavior that relates to social norms and can therefore be really sensitive for participants to talk about. So just thinking about some of the considerations for how vignettes are applied in research settings, while our study found that they're often used in written settings, in populations with lower literacy rates, vignettes can also be delivered verbally or as a video vignette, which can help decrease any need for literacy. In addition, the use of video vignettes has actually been shown to be a more equitable method of measurement across socioeconomic groups. Other requirements of vignettes, they should be simple, relatable, and plausible so that participants can easily understand what's being asked, but they should also avoid placing participants directly inside vignettes. Researchers can manipulate vignettes as well systematically to serve the research purpose. An example of this are some focus group studies that provide slightly different vignettes to each group by altering specific wording within the vignettes. And altering vignettes in this way helps researchers understand different aspects of an issue at play, such as different help-seeking behaviors in different contexts.
Thank you. So you mentioned female genital mutilation and child marriage, which are both examples of social norms. Can you give us a few examples of vignettes in other contexts, such as an individual context or an interpersonal context, which I believe your article also covers?
Yeah, so an example of vignettes used at the individual or interpersonal level, one example that we found from our review was patient-provider communication. So we found that vignettes have often been used in these scenarios, whether it's to teach providers how to interact with patients or even their specific knowledge or attitudes about a specific condition. One thing that we found was how information is displayed in those scenarios. So this is an example of an individual or interpersonal level.
Okay, great. Thank you. Moving on to the future of vignettes in health communication research, policy, and practice, what do you find are some of the areas for improvement in the use of vignettes in health communication?
Yeah, so our review found that most of the vignettes, as Lizzie actually already mentioned, so most of these were in quantitative studies that took place in North America. So I think one large area of improvement is to use more qualitative and mixed methods designs. Also, most of the studies in our review measured knowledge, attitudes, and behavior. And with an increased interest in using vignettes for measuring social norms, I think there's a huge opportunity here for more research, particularly when developed by local community members and not external researchers.
I see. Lizzie, would you like to add something to that?
Definitely. We also found that most of our published studies that were captured in this review use vignettes for impact or outcome evaluation of programs, but we think vignettes are incredibly useful both for formative and process evaluations as well. And I think they also may be a unique way to advance equity by more effectively engaging communities in formative evaluation, especially communities who might not be engaged with current research methods like the health literacy that we had talked about earlier. We also found that most vignettes, like Amy mentioned, were applied to patient-provider communication, but there are many other potential topic areas where vignette methodology could be applied, which should be researched as well.
Great, thank you. Amy, could you please talk about the implications of your research for the use of vignettes in evaluating health communication programming? Our podcast is mainly interested in looking at practical and policy implications of authors' research. So it'll be helpful to discuss what you found were the implications of your research.
Absolutely. So we think our research has several implications for health communication. First, I think I have to say this, I'm a public health professor. I think we need to ground more vignettes in theory, thinking a lot more about theory. Second, I think there's a lot more research that could happen in this area outside of North America and Europe. We found in our literature that review that there was a gap. So some of this work is being published in kind of public reports and manuals from global health organizations, which is great. But this hasn't translated. So there aren't very many studies that are crossing over into the peer-reviewed literature. So this is important so that researchers and practitioners know how these tools work and in what settings. I think vignettes are a really exciting area of health communication research. And I think there are real implications here for health communication research in general that aims to be by and for communities and grounded in principles of participation and participatory research.
Great. What are the potential implications of the use of vignettes for health literacy, engaging local communities, or advancing health equity across research policy and practice? Lizzie, would you like to answer?
Sure. I think, as we mentioned earlier, vignettes are designed to be narratives that are relatable to participants. And because they can be delivered via video or audio, or even in focus groups read aloud to participants, they can engage participants in a different way than written surveys or concrete questions can. Additionally, like we talked about earlier, vignettes shift a focus to a third party. So it can help to kind of alleviate the stress of responding to pointed questions about sensitive topics.
Fantastic. That was very helpful in understanding the potential usefulness of vignettes in all of these different fields. Finally, do either of you have any closing thoughts or anything that you haven't discussed yet?
I guess just in terms of a closing thought, I want to acknowledge and thank, I had a great student team that worked on this article and who contributed to this manuscript, including Lizzie, who led our team. And without her and the rest of the team, this publication would not have been possible. So I just want to give a shout out to the wonderful students who worked on this project.
Fantastic. So thank you so much, Dr. Riley and Lizzie, for this enlightening conversation, and the very best of luck in your future endeavors.
Thank you so much.
Thank you so much for having us.
Thanks for listening to Beyond the Article, Health and Communication Distilled, a podcast of the Journal of Communication in Healthcare, Strategies, Media, and Engagement in Global Health. Follow the journal on Twitter at JCIH Online for news about the articles we publish and other resources. That's JCIH Online on Twitter.